And while we're on like not needing technically surgery, a lot of my patients come in that have just had injections. How many injections per year does the research say that a patient could get without it being like harmful to their?
Well, in general, I mean, the way I look at injections is they're not good for your tissues, period. So I kind of say, look, I caution patients about getting them too frequent. I generally don't allow them to get any more than 3 or 4 a year. But I also look at that as, well, it really comes down to, all right, if you're needing an injection every 3 months and you're getting it for shoulder arthritis, well, the shoulder joint is probably pretty bad off. And if you're trying to say, well, I have really bad shoulder arthritis, but I'm not a good medical candidate for surgery, well, then you can get those injections and you could probably have them, 3 times, 4 times a year for the rest of your life.
Right.
But we already know that the condition of the shoulder is pretty poor. But if you're looking at it and you're looking at it from a soft tissue standpoint, and you said, well, there's a reason why your shoulder is hurting more so than just, inflammation. Well, if you continue to just inject, my philosophy is more, well, we're kind of putting a Band-Aid on the issue. Maybe we need to look a little more. Let's look at the MRI. Let's see if there's a reason that we can address with a more durable treatment than just getting an injection. So I try not to exhaust patients with endless injections unless that's kind of their wishes,
Right.
or they're kind of the patient who's just not a good surgical candidate, in which case the best we have to offer is helping symptoms without, modifying anatomy. So,
Right. I know that's a big thing just because, a lot of times they get relief for 6 months to a year, and some of them get relief for not even 24 hours. So it's just
right.
always like a crapshoot whether, it
No, I
helps
totally
people.
agree. Totally agree.
Yeah. And moving on to knees real quick. Is there any conservative treatment that you might do for someone that doesn't necessarily want to do surgery for knee arthritis or degeneration or anything like that?
Yeah, I think that, like, physical therapy is good evidence. There's good evidence behind it with knee pain, with knee arthritis. You tend to run into those patients who start to lose a little bit of their motion with knee arthritis, and in those patients where you can really gain their extension back and kind of try to maintain the motion that they've had, I feel like they tend to do okay. It's actually remarkable, some of the patients who come in with horrible looking knee x-rays and their knee doesn't hurt on that side, or, and you're kind of like, how do you explain that? Whereas, you look at some people and they have the littlest bit of knee arthritis and their knee hurts them. But, I try to exhaust all conservative treatments on patients with knee arthritis. I really like the bones, touching the bones if you're going to consider a replacement. I feel like a lot of people jump the gun and they're like, oh, I just want the replacement. But not necessarily appreciate or understand exactly what they're getting into. It is easy to replace a knee, but at the same time, they're not a perfect, outcome in all cases. 8 out of 10 people really like their total knee. Those are probably the people who are really bone on bone. They've really exhausted everything. So I really try to have those patients try a course of therapy, try your injections, maybe try the visco supplementation, all those different, which are the gel injections, the rooster comb that everybody talks about.
Mm-hmm.
But you try to just, you try to encourage them to go through those avenues before jumping straight to a total knee. Now, you do see some patients come in, who get frustrated. They may be that they've gained some weight. They're like, I'm just too, I feel like it's too hard for me to work out or exercise or try to cut back, and I just need my knee done because my knee's just getting worse, and they feel like they're chasing their tail. And, that's a tough scenario, but you try to get them to exhaust those things first. And, you guys probably see quite a bit of patients with knee arthritis,
Right.
both before and after surgery. So I do advocate for that.